For this segmental joint range of motion test, we are going to be looking at hip external rotation. So I have my client here supine, and I'm going to be moving his hip into 90 degrees of flexion and his knee into 90 degrees of flexion. And I will passively move him into external rotation, okay? For the use of the goniometer, I'm going to have the axis at the midpoint of the patella. I will then have the stationary arm down the midline, the imaginary midline of his body, and then the movement arm will be down the midline of his lower leg. So here we go. Let's get you into position. Okay, we want to make sure there's no rotation, no adduction, abduction. Okay, go ahead and hold that right there. And we're going to move you into external rotation. Okay, if you can hold that position. Awesome. Okay, and go ahead and relax. On the left side, my client is at 17 degrees. We'll move to the right side. Okay, move him into position. Good. Okay, and I'll move you to external rotation. Okay, go ahead and hold right there. Again, midline of the patella for the axis. I have my stationary arm down the imaginary midline of the body, and my movement arm down the midline of the lower leg. Okay, go ahead and relax. And for the right side, my client is at 22 degrees. You will note that optimal range of motion for external rotation is also 45 degrees.